Welcome, everybody. Thanks for joining our medical talk. Today, we're talking about the LAA occlusion with Professor Gämperli from Heart Clinic Hirslanden in Zurich. Welcome, Professor. Thank you for joining.
Thank you very much.
Professor, LAA occlusion. Would you mind explaining this a little bit and also explaining the procedure that you do?
Yes, LAA occlusion is a procedure to close the left atrial appendage in the heart. Why do we want to close the left atrial appendage? Well, because patients who have atrial fibrillation is one of the most common rhythm disturbances that occur with advanced age. Patients who have atrial fibrillation tend to develop blood clots in this structure, which is the left atrial appendage. And these blood clots, if they come free, they are a risk. They can travel through the body. And most of the times, unfortunately, they find their way somehow in the brain and can cause stroke. Okay, so we want to avoid these blood clots from traveling to the brain. And that can be done by closing or occluding this left atrial appendage with a device that hinders these clots from coming free.
And how do you do it? What is the actual procedure?
Well, there are surgical and transcatheter ways of doing that. In the percutaneous or transcatheter procedure, we introduce a catheter through the left or through the right groin and travel with this catheter to the left atrial appendage. And through this catheter, a small device which looks like a hat is placed on the entrance of the left atrial appendage. This device closes this structure, this anatomical structure in the heart. And if the device is in the proper place, it is released and stays there and avoids that any blood clots can be released from the left atrial appendage.
Very interesting. Is it also a minimal invasive procedure?
Yes, percutaneous left atrial appendage occlusion is a minimal invasive catheter guided procedure. So it is. We do not need to open up the chest to access the left atrial appendage. Everything is done through a puncture in the right or in the left groin. The procedure is generally done with general anesthesia, but occasionally can also be done only with local anesthesia and with a very rapid recovery.
Okay, so recovery time is, I would say, maybe around 2 to 3 days.
Yes, in fact, we tend to discharge our patients even earlier than that. A patient stays for very rarely for longer than one night after the procedure.
Okay.
Yeah.
Okay. Well, thank you. Thank you for providing us this input. Much appreciated. And hopefully we'll have the opportunity soon again to discuss more heart-related medical topics. Thank you, Professor.
Thank you very much.